Breaking news, dogs and cats have knees, just like we do. And our beloved pets can often suffer with the same kinds of problems we do. Our pet vet, Dr. David Visser, is with us today to discuss how you can recognize knee problems and what can be done for our pets. Good morning, Doc.
Good morning.
Good to see you.
When you talk about broken knees, breaking news and talking about knees, we don't want breaking and knees to go together.
Hey, something I want to touch on right away. Dogs have 4 legs, but that does not equate to 4 knees, correct?
That's true. You know, a lot of people think that front legs, that all the legs are built the same. Actually, their front legs are built much like ours, and so elbows exist in front. Somehow, elephants still have their front wrists called knees. But in any case, the knees are just like our knees. Now, in dogs, we call them the stifle. But in any case, the stifle, or the knee, is really an unusual joint. A lot of joints are very secure. They're like bone around bone, and that is very nice and secure. But knees are almost like a round end coming together with another round end of bone, and it's only held together by soft tissues. And what happens there is it makes it very prone to injury because there's only soft stuff holding it together. So this is why it's a common sports injury in people, and why dogs can also have the same kind of injury because their knees are built in almost exactly the same way as ours.
Now, is the terminology different? I mean, I've had a surgery for what they thought was a torn meniscus, and my wife has had an ACL surgery.
Yes.
When we talk about dogs, is it the same terminology?
Yep, same anatomy. Yep. So they have a meniscus, which is a shock absorber inside the knee, a C-shape or a cup-shaped thing to kind of hold the lower part of the femur, and sits on top of the lower leg, which is the tibia. And the meniscus is inside the knee, and no problems when the pressure is in the right place. But a cruciate ligament, which is the ACL, the ACL or anterior cruciate ligament, if that tears, then all of a sudden the pressure applies in a different place on that shock absorber. So many dogs that have an ACL rupture also have a meniscus tear.
Now, and I don't know if this is even possible, are there things we can... You've met the news dog.
Oh, absolutely.
And he is...
Honored.
He's 8 years old. He has got, he's like Zion Williamson. He's got like a 6-foot vertical leap, and he's got all this muscle on him.
Right.
And I am in constant fear that he's somehow gonna injure himself. And I don't know if there's things that that one as a pet owner can do to keep them fit and safe.
Yeah, I think the knee problems that exist, and the knee being a joint that is more prone to that type of injury, there are things that people can do. So keeping pets in the ideal weight certainly keeps the amount of pressure when they land at a lesser state, but also being moderate in exercise. Not every dog is ready for the marathon or changing direction suddenly. So when we go outdoors, we certainly have to be prepared that pets may not be prepared for the type of activity we wish them to have. So moderation on exercise and activity is important as well.
Let's talk about symptoms. How can I, as a pet owner, diagnose that the news dog's got a problem?
Well, first of all, I hope there isn't any issue, nor with any pet out there. But people should be tuned into the fact that dogs typically will limp, and that limping can be anywhere from a toe touching to carrying the leg, or just being ginger at certain times. But it's when we're talking about knee issues, of course, we're talking about the back legs. But swelling of the knee area is kind of hard to find. Now, I want to first describe that pets stand on their toes, okay? So the joint that points backward above the toes is the ankle, and the one that points forward above that is the knee. That's kind of tricky for some people to understand that anatomy, but some people will also notice when they're palpating or feeling the back leg that they will find a painful area. Most people think, hey, there must be something with the toe or something stuck in the toe. Limping on a back leg will look the same almost regardless of what part of the leg is affected. But there are certain things that can cause joint issues. Lyme disease, we're not going into that today, but that can cause fever, and that can also then produce signs of losing an appetite, not being very active. So there's a myriad of signs that can go along with it. Number one, though, is limping. There isn't really a normal limping that occurs, and we want people to be tuned into that. Contact your veterinarian if that happens.
Let's talk about treatment. Is it, I mean, do we do arthroscopic surgery on a dog?
Yeah, it is possible, but the equipment is very expensive, and it has not permeated into general practices to a great extent. So specialty hospitals can do that kind of thing. Most of the operations that are done are either done at specialty centers that don't have that equipment, or veterinarians that are capable and qualified to do this type of operation, whether it's ACL repair or kneecap cap issues. And we've done a lot of these at our office, but check with your veterinarian if your pet is diagnosed with those conditions as to whether they are capable of doing that. If not, be prepared. You might have to go to a specialist or seek somebody locally to do this. But operations are not the only thing that's necessary. Sometimes, like with Lyme disease, it's medication to manage it, or if conditions have progressed enough, maybe only we have the option of pain management. So lots of different options depending on the diagnosis, the severity, and how what the treatment is available.
So if we stop short of surgery, we're really talking about keeping an animal comfortable.
That's really the most important thing. You know, in general with pets, we want to manage and maintain quality of life, even over quantity of life. Now, none of the conditions I've talked about are life-threatening, but we want to make sure pets are comfortable in all of the things that we do with them. That's what really enriches their life, and enriching their life, they enrich ours.
All right. Hey, Dr. Visser, thanks so much for coming in with us. And if you want to contact the pet vet, Dr. David Visser, and I full disclosure, he took care of my spotopotamus, and he did a great job. You can reach him at the Center for Animal Health by calling 888-PETS-VETS, or you could always shoot him an email at michianapetvet@comcast.net. Doc, thanks.
You're very welcome.
And we hope you'll stay tuned for more of 16 News Now Saturday morning. We will be right back in just a moment.